What is blood pressure? Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps. It's one of the most important measurements of how well your heart and blood vessels are working. Systolic versus diastolic pressure. Blood pressure has two numbers. Systolic, top number, pressure when the heart contracts. Diastolic, bottom number, pressure when the heart relaxes. Both numbers matter for understanding cardiovascular health. Normal blood pressure range. A normal blood pressure is generally below 120/80ths of a millimeter of mercury. This level means your heart and blood vessels are working efficiently without extra strain. Blood pressure stages. Elevated, 120 to 129, below 80. Stage 1 hypertension, 130 to 139, 80 to 89. Stage 2 hypertension, 140 plus, 90 plus. Hypertensive crisis, 180 plus, 120 plus, medical emergency. Dangers of different stages of hypertension. Elevated blood pressure, 120 to 129, less than 80. Even though this is not yet hypertension, arteries begin to stiffen, and the risk of developing full hypertension increases. Early changes in the heart and blood vessels may already start. Stage 1 hypertension, 130 to 139, 80 to 89. At this stage, damage begins silently. The arteries become less flexible, the heart works harder than normal, and the long-term risk of heart disease and stroke increases slowly but steadily. Stage 2 hypertension, 140 plus, 90 plus. This level puts significant strain on major organs. The risk of heart attack, heart failure, kidney damage, and vision loss rises sharply. Blood vessels in the brain and eyes become more vulnerable. Hypertensive crisis, 180 plus, 120 plus. This is a medical emergency. Blood vessels may rupture, the heart may fail, and the brain can bleed or swell. Without immediate treatment, it can cause stroke, heart attack, acute kidney failure, or death. What causes high blood pressure? Common causes include genetics, stress, obesity, high salt diet, lack of exercise, smoking, alcohol, and certain medical conditions like kidney disease. Symptoms. Symptoms of high blood pressure. Hypertension is often called a silent killer because most people feel no symptoms. Severe cases may cause headaches, chest pain, dizziness, blurred vision, or nosebleeds. What happens if hypertension is untreated? Untreated high blood pressure can damage blood vessels and lead to heart attack, stroke, kidney failure, vision problems, and heart failure. What is low blood pressure? Low blood pressure, hypotension, is typically below 90/60ths of a millimeter of mercury. It can cause dizziness, fainting, blurred vision, and fatigue, especially when standing up quickly. How to maintain healthy blood pressure? Reduce salt intake, manage stress, maintain a healthy weight, exercise regularly, avoid smoking and limit alcohol. White coat hypertension. Some people experience higher blood pressure only in medical settings due to anxiety. This is called white coat hypertension and can lead to false high readings. New research in 2025 on blood pressure. A new phase 3 clinical trial, BaxHTN, showed that baxdrostat, a novel inhibitor of aldosterone production, reduced systolic blood pressure by about 9 to 10 millimeters of mercury in patients whose hypertension was uncontrolled despite multiple medications. Thank you for watching. Like, comment, and subscribe for more.